So today I'm going to talk about the 9 types of acne that you see in skin of color. 6 are pretty similar that you see across all ethnicity, but there's about 3 more that I see that I find common in skin of color. So let's start. Number 1 is whiteheads. Whiteheads are small white bumps that you see around your skin. They look quite similar to your skin, but you know you have a bump on your skin. Number 2 is blackheads. Blackheads are quite similar to whiteheads, except that they have been exposed to air. So when they're exposed to air, it oxidizes, which means and then it shows that black color on the skin. Number 3 is pustules. Pustules are pus-like, so they have that yellowish white substance that looks as if they're about to burst, and they'll be quite painful to the touch. And number 4 is papules. Papules are similar to pustules, except that these ones are very painful. It looks like it doesn't have a head. You know, when you have this acne, it doesn't have a head, but it's still quite painful. So that's papules. Number 5 is nodules. Nodules are bigger. They're quite big, very painful, very sensitive, and can cause a lot of scarring. Number 6 is cystic acne. Cystic acne are red. They are quite painful. They're big. Could easily get inflamed and it could get infected as well. That can cause a lot of scarring as well. Now there's number 7. Number 7 is what we call pseudofolliculitis babae. Basically, it's ingrown hair. Essentially, the scientific name is that name. It's ingrown hair, but it's a mixture of whiteheads and blackheads that you see around your ingrown hair. So when your hair follicles around the beard area is inflamed and clogged up, so you get that. Now number 8 is pomade acne. We know when we use those oils that can clog up hairlines, quite thick oils that could be really bad for the hair, as well as actually cause the redness around the hairline area. Pretty red, pretty inflamed. That's what it's called, pomade acne. Now number 9 is AKN. It's called acne Keloidalis Nuchae. Essentially, it's what we find in a lot of men. Shaving, the way they shave, the way sometimes if you use somebody else's clip or use the barber's clip and not yours, especially if you have a sensitive skin, you get that acne bump around the back area. And then also when you use collared shirts, you know, collared shirt can be quite irritating sometimes. So when you move around, a lot of men get that bump around the back of their head. That's what they called AKN. So essentially, those are 9 types of acne that we see in skin of color. So how do you treat these 9 acne types that we see in skin of color? So I'm going to combine whiteheads and blackheads and use what I call the CAMS code, the Cleanse, Activate, Moisturize Sunscreen. If you want to know more about the CAMS code, just go ahead and use the thumbnail nail where you can actually understand how to layer your skin and what do we do first, how best do we get the best result for our skin. So the CAMS code can help you with that. Now let's talk about whiteheads and blackheads. As I said before, whiteheads are small bumps that you see on the skin. Sometimes it looks like the color of your skin, but really it's whiteheads because once you press it and extract it, you see white pus coming out of it. They're quite thick as well, so that's the whiteheads one. With whiteheads and blackheads, this is one of those things where you want to really go fire the CAMS code. So cleanse, number 1. Cleanse, even for any skincare routine, cleansing is a key part of your skincare routine because it actually helps you prepare for the next stage. It gets rid of dirt, bacteria, makeup and so forth, and really keeps your skin ready to use actives for it, and actives can easily absorb much more quicker. Just, I think cleansers with salicylic acid are very good when you have whiteheads and blackheads, and then you want to use hydrating cleanser as well. So I tend to recommend both cleansers where you're hydrating your skin as well as using the right actives on the cleanser to help dislodge the pores. With whiteheads and blackheads, that is when I actually advise people to use a toner. I don't use a toner in all the treatments. I actually don't believe in using a toner for everyday use. I don't believe in it. If you want to use a toner for whiteheads and blackheads, that is when I will support you, because when you use the right toner that contains salicylic acid, it actually helps to dislodge your skin a bit more, get rid of this hard bumps that you see on whiteheads, help you to extract your skin. That's what you really want to do with whiteheads and blackheads. So that's on the activate side. So using the toner is the key part. Once you finish using the toner, you actually want to go ahead and hydrate your skin using the hydrating serum that contains hyaluronic acid, just very glycerin, very gentle hydrating serum. And then you want to go ahead and use blemish block. Blemish block helps your skin heal itself pretty quickly, so you have less whiteheads and blackheads going forward. Now once you use blemish block, the M is now to moisturize. So we've done to cleanse, activate by using the toner, hydrating serum and blemish block, and then you want to moisturize your skin. Only moisturize the skin if your skin still feels tight and dry, like you really have that tight feeling like, oh my god, I still feel like I need to use a moisturizer. That's when you really have to moisturize, because a lot of actives these days contain hydrating products to really hydrate and moisturize your skin. Moisturize if you have to, and then go ahead and use sunscreen in the day. At night time, you really want to just do cleanse, activate, moisturize. You want to cleanse your skin with the right cleanser. Double cleanse if you have to, especially when you have makeup on. Use the right actives again. Use a salicylic acid toner and use blemish block, a hydrating toner. But actually at night time, I like you to moisturize a little bit, because nighttime our skin are much more vulnerable. Nighttime our skin is much more exposed. Nighttime your skin is actually renewing itself, so it needs a bit of food. Moisturizing your skin at night is actually quite key, because you're giving your food the nutrients it needs. So when you wake up in the morning, your skin feels a bit more refreshed, more softer. But if you don't moisturize, sometimes you can wake up and your skin feels a bit dry. So you actually really want to moisturize at nighttime. And that will be it on treating whiteheads and blackheads. When you have whitehead and blackheads, do not try to extract at home, because by extracting at home, let me tell you what happens. Two things. One, you actually do not get all the acne sac out at home. It's very painful, I understand, but you don't get all the acne sac out. So when you come into the clinic or you see a skin facialist or esthetician, when they try to extract, they've given them extra work to do, because there's now extra layers of skin on top of that acne that you have. So you see that bump, it feels hard. That's because you've touched it. I always can tell when my clients have touched their skin. I'm like, you've touched it, because it forms that extra layer of skin. The other thing you don't want to do is, because when you extract at home, you then cause even further scarring. When you extract in clinic, or when you have a good facialist, when they extract your skin, they don't cause you further scarring. So you really want to avoid extracting whiteheads and blackheads at home. Just go to a facialist where they can do deep cleansing on your skin, extract it, and try to get it out. That's essentially it for whiteheads and blackheads. Let's talk about the other two, which is papules and pustules. They're essentially the same thing, except that with pustules, you have pus. So you have the white yellowish substance that is very painful. These ones looks like they're about to burst. Now, how do you treat papules and pustules, which is like the ones that are really about to burst, very painful ones? The way you treat is, number one, I think you should ask yourself questions like, what triggered this? So for example, for me, when I eat a lot of cashew nuts, maybe I eat a whole bag of cashew nuts within a day or two, I know that I'm going to get papules and pustules, especially under my chin area, and it is painful, it is hard to deal with. So I try to manage. I still eat cashew nuts because I can't help it, but I try to manage it to make sure that I don't eat a lot all at once. So what are the triggers for you? Because there's always a bit of a trigger that causes you to have that papules and pustules. Is it hormonal? So could it be hormonal acne that you have? Because if you have hormonal acne, then that would cause that sort of more acne around this area. A mixture of whiteheads, blackheads, papules, pustules. You get a lot of it around the area that causes hormone, because hormone is seen around the jawline. Ask yourself, what are the triggers? Because if you can manage the triggers, then you can manage not reducing having that sort of acne on your skin. So once you can deal with it internally, using the right watch your trigger, eat the right food, right supplements, and so forth, then we can now start treating it topically. When you have the papules and the pustules, like the big acne is very, very painful, the first thing I want you to do is actually use a cold compress. I know it's very, very tempting to want to bust it, but the last thing you want to do, especially when you have those white big pumps that you can actually see like it's about to burst, the worst thing that you want to do is to bust it, because when you bust it, you're spreading that white yellowish substance around the area of your skin. Find out that maybe a month or two after, you're getting acne in the same spot, you're getting acne around that same spot that you busted, just because look, it gets infected. It's just giving it a more of a leeway, almost like it has a drive-through for acne to always come out. So you actually do not want to bust it at home. Go and see your esthetician, facialist, that will really help you manage that. And so do not bust it at home. Use a cold compress, like an ice globe, cold towel, a bit of ice, just to really calm that inflammation down. And that's the first thing you want to do. Now, once you've done that, when you have those massive acne like you really want to just bust, where I don't support toner is in this situation. You don't want to use a toner, because when you use those toners that contain salicylic acid and so forth, I actually find that now that helps to dislodge the pores. However, I feel like it gets spread a bit more. So I see more people coming out with even bigger pustules and those bigger pimples because they've used a toner. So in that case, what you really want to do is just calm inflammation, because I always say this, every inflammation has the potential to cause hyperpigmentation in skin of color. So you want to just calm that inflammation. You want to tell your skin, look, just calm down, do not produce more melanin, do not make it darker, even though it would get darker but not as dark. That's what you really want to do. So once you use the right cleanser, a gentle cleanser, a benzoyl peroxide, it's like a BP wash, is a very good cleanser for people that have those massive pimples. I find benzoyl peroxide really work quite well. Sulfur cleansers also work quite well as well. So once you finish cleansing, then you now want to use blemish block, or you want to use a gel. You want to use blemish block because you want to use your skin to really begin to heal itself, to stop you from having more blemishes. Then you want to use a gel to seal in whatever it is you've done. So a BP gel, a Duac gel. I find Duac gel are quite good. This is when you have to go and see a dermatologist that can prescribe prescribe the right one for you. So a DOAC gel will contain something like a benzoyl peroxide plus clindamycin and antibiotics. So what that happens is it helps to treat the bacterial effect of the acne, of the pimple, and then the benzoyl peroxide will help to calm the inflammation and really just try to manage it and really try and get rid of it. So you want to use like a BP gel or a DOAC gel or one of those ones that can help you just stay on your skin. Once you've done that, go ahead and use the sunscreen during the day. At night time, you want to do something quite similar. What you want to do is use the right cleanser. So you want to use like a BP wash, benzoyl peroxide wash. You want to use a BP gel afterwards, and then you want to just leave it like that for the next 2 weeks. After 3 weeks, then you can start introducing things like retinoids, retinols, and things like to help you, number one, tell your skin to act younger. Then number two, help to get rid of as much acne and hyperpigmentation as possible. Or there's a way you can actually do whereby you can do 2 or 3 days. That's why it's always best to contact your esthetician or dermatologist that can tell you exactly what steps to take in managing those big pimples called papules and pustules. So that's it done for the 4. Now, when you have the number 5 and number 6, which is nodules and cystic acne. Nodules and cystic acne really need to be seen by a dermatologist. This is because they can actually prescribe the right sort of tablets for you. So for example, you might have to go on Roaccutane. You know, we can never tell. You might have to go on Roaccutane. You might have to use things like spironolactone, and they might give you things like more antibiotics to really help you deal with it. But most importantly, the dermatologist will ask you questions like what could be the underlying cause? Is it hormonal? Have you always had it? How long have you had it? They'll ask you, and even consultations that you go through, even with estheticians as well, will help you with they'll ask you all these questions because they need to know the underlying cause of it, so that when you can treat the underlying or manage the underlying cause of it, you can then use topical products to help manage. You're both doing in and out sort of treatment to really help manage it and get rid of it. For some people, let me just be honest, some people will always have acne for the rest of their lives. And if you have acne for the rest of your life, I want you to know that look, 1 in 4 people have experienced acne. Acne is actually on the rise because of the food, environmental factors, and so forth. So I always say that look, you're not alone. Just ask somebody that is a professional to help you treat your skin, and they will give you as many solutions as possible, and they'll work with you to get to the right solution. But it can take time. Nodules and cystic acne can cause scarring, are the ones that actually are hard to treat sometimes, and can take as long as a year for you to see results. So you have to be really patient with yourself, patient with the program, patient with your skin journey, and find the right person to help you treat your acne. So I've covered 1 to 6. I've covered 6 types of acne. Now let's move on to the other 3 that I find a lot in skin of color. Number 7 is pseudofolliculitis barbae, basically ingrown hair. I mean, a lot of women have ingrown hair, PCOS, or just naturally, genetically have ingrown hair. Now, the way they shave really matters to really reduce ingrown hair. Let me say how ingrown hair happens. I'm just going to give you a quick background. Ingrown hair is basically saying the hair has come out and it's come back down on the skin, or the hair came out but it stayed within the skin and then came back in and went back right into the hair follicles. So it creates sort of a bump on your skin. Those are 2 common circumstances where you have ingrown hair. Or some other hair came around the area of the skin and then went back into that skin. So sometimes it can cause that inflammation. And when your hair is clogged up like that with whiteheads, blackheads, and ingrown hair, the first thing you want to do is manage your shaving process. I know we all like to quickly shave and do all that. We get this around the bikini area as well. Ingrown hair happens around the bikini area. Ingrown hair happens around the arm as well, around the armpits, as well as the beard area. Somewhere here, you'll find out how I actually talk about ingrown hair and how to treat it, what is it, how to treat it, and how to manage it going forward. But just to give you an idea, when you have ingrown hair, this pseudofolliculitis barbae, how you shave your skin really matters, and the days before shaving really matters. I always say 2 days before you start shaving, start using an exfoliating product to soften your skin, and then on the day of shaving, you actually want to just use a bit of a warm compress, a warm towel to prepare your skin for shaving, and then you want to use something like a gliding solution, maybe a soap, maybe an oil, or even serum to shave in the right direction of the shaving stick. Once you've done that, you also want to then exfoliate just a bit more on that part of the skin. You then want to look at it and see if there's any inflammation. Use a hydrating serum afterwards. Once you finish having a shower, use a hydrating serum like blemish block afterwards, and then every single day for the next 3 days, use a toner around that area. That really helps to manage ingrown hair. That's how you basically treat ingrown hair or pseudofolliculitis barbae. Okay, so that's number 7 done. Now number 8, pomade acne. Pomade acne is caused when you have other oil or that redness around the hairline. It's called pomade acne. Pomade acne is caused by using the wrong clogging product around your hair. So a lot of us times, it's always good to see a trichologist or a hair coach or somebody that can actually treat your hair quite well. We actually don't need that much oil on our scalp. Our scalp produces enough oil, but let's just leave that. So when you have pomade acne, because you've used the wrong oil or the wrong solution for your skin, what you want to do now is just calm the skin. That's the first step. Calm the skin down. Number one, stop using the product, get rid of the product. Yeah. Number two, find a very gentle wash to wash your skin. In this case, facial wash is enough to actually help you wash the skin off. Once you've washed it off, you actually want to use a hydrating serum. Hydrating serum to calm the skin down. Now it all depends on what stage of this pomade acne is. If it's very red and inflamed, all you want to do is just calm it down. In a few days time, it tends to clear up itself. Now if it's bumpy, very bumpy and hard, then you want to use a bit of toner around that area and then hydrate it, and that's all you need to do. In a few days time, these things really tend to clear up. If it's now becoming white and inflamed, quite infectious, please visit a dermatologist or trichologist and they'll tell you what to do next. Now the last one is number 9, which is the acne Keloidalis Nuchae, AKN, the one that we get around the neck area. Now with that one, you actually want to watch how you shave. A lot of people just have their own shaving tools. They don't rely on the barber shaving stick. Barbers are quite good. They can find the right disinfectant, but if you have a sensitive skin, just have your own shaving tool. I've had a story of a guy that actually used the barber shaving tool. It ended up becoming so bad they had to do an operation at the back of his neck, and they realized that the sac of acne was so deep that almost nearly reached his neck area. So they had to try and get it out, wash it, and then do surgery to actually protect that area. It can be really, really bad when you have those little bumps at the back of the neck. So what you want to do, number one, is you have the right shaver. Have the right shaver. If you're sensitive, have your own shaver. Then tell your barber, or when you're shaving, to shave in the direction of the hair growth. That really helps to reduce it. Once you've done that, wash it and use the right toner to really just help dislodge any hair that really wants to come back and go back. So basically it's an ingrown hair. Ingrown hair at the back of the neck. That's what AKN causes. So you actually want to reduce that. Also following the same step as you would as ingrown hair. What? Number one, watch me exfoliate if you can. Number two, use a toner. Number three, use the right shaving stick. Number four, toner again. And then number five, moisturize or hydrate it. That will really help to manage the AKN that you get at the back of your neck.